Hey, this is Lynn. I am here today to go over my tilt table test results. I had this test done last week and I did get the results a couple days later, but I was very confused by them. So I reached out to the cardiologist who I had also seen 2 days before the test just to ask him to look over the results and give me some, his thoughts on it to see what he was, how he interpreted it. So basically, when I went to see the cardiologist, he did some manual like blood pressure readings, sitting, standing, particularly listening to the blood flow and, my heart rate and monitoring all that. And when I looked at his the report from my visit, he assessed and diagnosed me with orthostatic intolerance. So his thought was that the tilt table test would very clearly state exactly what type I had and give us a little more clarity on that. So 2 days later, I had the tilt table test and it was negative. It said that there was a little bit, it says excessive pulse pressure contraction in phase 2 is non-specific, maybe more sensitive to factors causing reduced venous return, such as volume status, basically how much water I've been drinking. But it says autonomic screening tests were otherwise within normal limits. The findings do not meet criteria for POTS, which I knew, or orthostatic hypotension. And so, it said here, tilt table test produced symptoms of warmth, nausea, blurry vision. Typical symptoms of dizziness were not induced. And so I was like, okay, I don't know. I still have the symptoms. So if it's not autonomic dysfunction, then I got to keep investigating, figure out what's going on. But I figured, well, let's have the cardiologist take a look at these results and give his opinion. So I sent him a message. I sent him the results, asked him if he would take a look at them. And he did. And he came back to me and he said that he doesn't think the tilt table test is necessarily that reliable. I wish I would have known that ahead of time. But he also thinks that the fact that I've been loading up on the sodium is maybe impacted it. Now, I didn't know that I wasn't supposed to drink electrolytes. It said no food. And so I drank my water with a packet of Element that morning. So I don't know. Maybe I messed it up for myself. But he did say, he looked at all the vitals, and he did say that I had what he views as an abnormal rise in heart rate. My blood pressure started out, maybe in 130 over 70-ish. And during the course of the actual tilt table study, went up quite a bit. And then it ended up as we got towards the 15-minute mark, it started to drop and my heart rate started to go up. My resting heart rate was in the 60s, and my heart rate actually ended up going up over 100, just a little bit over 100 as we got towards the 15-minute mark. So obviously my body was trying to get my blood flow to my brain. And so he basically said he thinks that I just have not a classic form of autonomic dysfunction. He said there are other, less classic forms of it. He felt very confident that I do still have orthostatic intolerance. So I guess I'm going to go with that. I'm a little bit disappointed that the test that I went through wasn't super clear. And the cardiologist does think that because I'm taking the electrolytes and, doing things to try to help myself, that it's at least helping with making it take longer before I start to feel like I'm going to pass out. Now, I could feel it coming while I was doing the tilt table test. And I did report on this when I did my video that day. I could feel it coming, but it did not happen during the tilt table test itself. So basically, that's the results. They were conflicting as far as the two visits, but I I know the symptoms I have, and so I'm gonna agree with the cardiologist and say, like, some of the things I've been doing to help myself are probably helping and affected the reliability of the test, which is pretty much his words exactly, was that the test is not always that reliable. Yeah, so that's it. So from here on, I need to continue doing what he calls salt loading, which is basically, drinking the electrolytes, adding as much salt as I can, making sure I'm getting plenty of fluids, wearing compression stockings, continuing to work on having good core strength. And, of course, I have to dive down rabbit holes. So of course I'm going to look into all the things that affect autonomic dysfunction. I do need to continue detoxing from mold, so I need to make an appointment with the naturopathic doctor that I saw, who is a mold specialist. And so I'm going to do that, get with her, see what she recommends as far as continuing to detox from the mold. Hopefully that will help. But there's other things that I'm going to look into and see what I can do. I want to see what I can do to increase my vagus tone. Vagal nerve is very important. And I'll just report back as I learn things, as I always do. So anyways, I'm going to keep this short today, and hopefully everybody is having a wonderful day. And if you have any questions, don't hesitate to post something in the comments below, and I'll do my best to answer. All right, take care. Bye-bye.